Well, 9 out of 10 people with pre-diabetes and 1 out of 4 diabetes do not know they have this chronic condition. Dr. Gregory Deines specializes in endocrinology and diabetes with Spectrum Health Medical Group. And of course, he's joining me now to discuss managing this. And also, he's brought along with him Lynn Dewitt. Thank you so much for being here with us, both of you, today. Thanks for making the trek in this awful weather. We appreciate it. Let's back up and just go to the basics and talk about what is diabetes.
Sure. Well, diabetes is a condition that occurs when your body is not able to use sugar appropriately, and sugar builds up in your blood and causes high blood sugar levels, which can damage organs such as your eyes, kidneys, nerve endings, and increases your risk for heart attack and stroke.
Mm-hmm. What are some of the symptoms these people will be feeling?
Well, initially, and unfortunately, sometimes there may not be any symptoms. And that's important to go to your doctor and get routine blood testing if you're at risk for diabetes. Mm-hmm. But some of the common symptoms are extreme thirst, frequent urination, unexplained weight loss, generally feeling fatigued and feeling poorly for a long period of time, and you may not understand why.
Mm-hmm. So we have the symptoms out there, but then you guys really need to go ahead and try to diagnose exactly if this is diabetes, if this is something else, and then there's different levels of diabetes too, right? Yes,
yeah, there are different types of diabetes. Mm-hmm. The most common type is type 2 diabetes. And then about 5% of the people have what's called type 1 diabetes. Mm-hmm. And people with type 1 diabetes are those whose pancreas does not make any insulin at all, and they require insulin injections in order to survive. Mm-hmm. People with type 2 diabetes can use a combination of medications, such as sometimes pills, and they may often need insulin injections also.
Okay. Lynn, what is your role in all of this?
Well, I'm a registered dietitian and a certified diabetes educator, and I work in a Center for Diabetes and Endocrinology with Dr. Deines. And my role is to take the information or take the prescriptions that Dr. Deines gives the patient and then try to help fit that into the patient's life. Mm-hmm. As far as the medicines. Also, there's a lot of self-care behaviors that the patient needs to learn to do, mainly monitoring their blood sugar, changing their diet, eating healthy, maybe a little bit of weight loss, and certainly exercise. So yeah. I work with Dr. Deines in that way.
Spectrum Health has an array of treatment options. I think people need to realize this isn't a death sentence. This is something that is
Correct.
Treatable. So what kinds of things are you guys doing at Spectrum to help out?
Sure. So one of the most important things that we want people to understand is that treating diabetes can be complicated, can be complex, and that nobody has to do it alone. And it takes a team of people to be able to do that. And so we have resources. We have diabetes experts and endocrinologists. We have a whole team of diabetes educators and nutritionists. We have behavioral health specialists, all that work together with the patients to help them take care of their diabetes.
Mm-hmm. As far as education, who should be the ones that get the education?
Well, I would say anybody who's newly diagnosed needs to have comprehensive education from as soon as possible from the diagnosis. And we usually do it in a one-on-one situation initially, and then they have the option of taking a 9-hour comprehensive class. Mm-hmm. And then from that point on, once they're diagnosed, it's really important to continue education on a yearly basis, so at least annual or biannual, just to make sure that you get all the information and the support you need for your diabetes.
And some people cringe because they instantly think there's a cost associated with this. So how does that work out when it comes to payment or a cost?
Well, diabetes education is covered by most insurance companies. The degree of the coverage depends on your insurance plan, but many insurance plans cover all of it.
Mm-hmm. And you talked a little bit about, managing weight and that sort of thing, a diet. So what exactly is considered a diabetic diet for people at home that are struggling with this? Maybe some pointers.
And so when I have people come in to see me for the first time, that's the thing they're most feared about. They're fearful they have to give up their favorite foods. They're fearful that they can't go out to eat anymore. They have to change their lifestyle radically. And really, we just talk to the person about eating healthy. We talk to them about managing portion sizes, which is really a big part of it. And so really we tell people they can really eat anything they want as long as they watch their portion sizes and understand how each food affects their blood sugar.
Okay. If people are watching at home, this is all overwhelming to them. We've thrown a lot of information to them and they think, I want to get one of those education classes again. Is it best maybe just to start with your primary doctor and they can help put them in one of these classes or get them pointed in the right direction?
Yeah, they usually need a referral from their primary physician, and then we take it from there.
Okay. So once again, you guys have the educational programs, you have a wonderful staff, and we're pleased to have them right here in West Michigan. So thank you so much for stopping by. And to contact Spectrum Health Medical Group's Center for Diabetes and Endocrinology, go ahead and visit 4100 Lake Drive, Southeast Suite 200, which is in Grand Rapids. Give them a call at 616-267-8950. Visit them online at shmg.org/diabetes endocrinology.